Okay, hi all. Now we will be discussing the next type of psychophysiological measurement, that is the cardiovascular measures. So cardiovascular means it is related to what? Our the cardiovascular means immediately we will think about the heart and blood vessels, right? These two things are very important, right? So then what are the different equipments, different kind of equipments which is available to measure the functionality of the heart and functionality of the brain? Means immediately we will say like one is ECG, another one is BP machine. So that is the equipment we will be discussing here to measure same thing for physiological psychological psychophysiological measurements, right? So first we will take on that is ECG. That is this is the equipment where you will measure the electrical activity of the heart, and the application of using this particular ECG here is that you will easily assess what is the heart rate and rhythm and abnormalities of the patient. So the unrelated variation of the heart based on the circumstance or based on the situation, we come to know what is the behavior of the patient. Okay, that in that way the EEG plays a very important role. Next, the advantage of this particular equipment is that it is commonly used compared to other EEG and other EEG and MEG kind of measurements. The reason is that here people will feel more comfortable since the very less number of electrode is being involved here compared to EEG. So EEG we have more number of electrodes and we will be placing on the brain, that is the skull over the head. So compared to that, the comfort of patient when taking measurement is very important. So that important, the comfort zone is more high in case of ECG measurements. And limitation is that as we discussed in EEG, here also we have some kind of external noise interference. Okay, so next we will see blood pressure. So we discuss right now what is the cardiac electrocardiography. That is all about heart measurement, heart functionality of the heart. As we will see the blood pressure. So because the blood pressure plays a very important role, that easily tells that what is the status of our body. Okay, when and without any reason the patient BP is very high, means immediately we people will get panic that something is going wrong, right? So the BP, that blood pressure is gives or says all about the status of our body, because when same thing, okay, same thing, the psychological study also we can do with the help of same blood pressure. When they are very normal, their patient BP is in normal rate. When they are get tense, when they unusual tense, or they are panic or anxiety, or if they are very happy or something, so based on the different emotional states, definitely you can see the changes in the BP. So from the BP we come to know whether the patient is like what kind of state they are, what kind of mood they are, or whether they are telling lie or truth or something. These kind of things we can easily get from BP measurements. Okay, that is the reason here we are discussing what why we have to go with BP, that is a blood pressure. So for that we have plenty of device right now, that to these current medical field. We have a manual method, automatic, semi automated, and so on. So these blood pressure will give the details about what is the tension which is exerted by the blood against the walls of the arteries. So the application is that you can easily assess what is the cardiovascular health, and you can easily read the stress response and autonomic nervous system function. The advantages is very simple device, we can easily used, and it is a portable one. And limitation is the same, it can be influenced by factors such as anxiety and cuff placement. Okay, so anxiety is also one of the reason. Without any without any knowledge, there may be some reason the BP will get shot out, or if the person is taking some kind of medicine which have side effects of increased BP to be increased. So these kind of side effects or some kind of practical challenges are there when we are looking into blood pressure. Okay, So next is heart rate variability. This is a main thing we will take into account when you are looking for psychological state study. The purpose of this heart rate variability is here we will analyze what is the fluctuation of the heart when we are measuring heart rate. From this fluctuation, the changes happen in heart rate. We come to know what is the response of that. That means what is the state of that particular person. Okay, so application is we can assess the autonomic nervous system activity, stress level, and the emotional states. The advantage of this particular heart rate variability is that it is very sensitive to subtle changes in physiological state. Okay, even the minor changes happen in the physiological state that can easily correlated with heart rate variability. And limitation is it requires very specialized analysis techniques, so that is find as some kind of difficulties when you are using with the heart rate variability.